I'm Dr. Matthew Davis, and this is Dr. Bryan Hammer, and we're here with Crossroads Chiropractic, and today we're going to talk about one of our favorite topics, which is chiropractic for health and wellness.
So a common question for chiropractors is, what exactly do you guys do? And the simple answer for that is that we work with the brain and we work with the spinal cord, okay? The central nervous system. And what I always like to talk about is how the brain is going to communicate to the rest of the body. And a simple question that I ask back is, what is the most important organ in the body? And a common answer would be the heart. And while the heart is extremely important, it's actually the brain. The brain is the most important organ because it's controlling the function of the rest of our body. And the only way that it can control the function of the rest of the body is through the spinal cord. So the brain's going to send signals down the spinal cord, then through spinal nerves, it goes out to the organs, cells, tissues, also it goes to the muscles, okay? From the organs and the muscles, what happens is they send a message back to the spinal cord, and it goes back up to the brain, and that's where it's registered. And that's kind of the brain-body connection that chiropractors are beginning to work on. Now, the three things that cause pinched nerves along the spine that can disrupt the brain from communicating to the body are the three T's: thoughts, traumas, and toxins. Okay? The three T's, those disrupt the nerves, and what they do is they begin to pinch off. When they pinch off, it doesn't mean that they completely pinch the nerve off to where it's not functioning at all, but it cuts it off by 10, 20%. And I always ask the question, if your heart is only being as productive as 80% of what it should be, is that a good or a bad thing? And simple answer is, that's a bad thing, all right? If that was me, I want my heart functioning at 100%. So extremely valuable that the brain can communicate to the organs and the muscle tissues.
So when we break it down and zero back in to health and wellness and chiropractic, chiropractors are the only ones trained to find and correct these pinched nerves. You know, there's warning signs of pinched nerves like muscle spasms and joint restriction and inflammation and tightness, but you know, in some other types of treatments can kind of relieve those symptoms temporarily, but really the cause of the problem is a pinched nerve. If the cause of the problem is a pinched nerve, that's just a temporary relief. So with chiropractic, we have special technology, at least at Crossroads Chiropractic we do, that actually measures that nervous system. And so it actually shows, we have a technology that shows, this shows pinched nerves to the nerves that go to muscles, and this thermal technology shows pinched nerves to the nerves that go to organs. And so we figure that out. We do x-rays to look for any kind of degenerative changes or any kind of problems with the spine that can tell us kind of how long those pinched nerves have been there or how they're affecting, how your pinched nerves or the nervous system is affecting the spine and its joints. We also do a really neat exam, chiropractic exam, where we feel along your spine for those classic signs of pinched nerves like muscle spasms, joint restriction, any kind of problems in that spine. We can kind of feel kind of like a blind man reads Braille. So some really neat stuff. We base our what you need based on individual person and how we measure that and how through our different exams and our physical exam, and then we sit down and kind of cater to that person exactly what they need and how long they might need it. So really, there's a lot of people out there that are healthy because they eat good and they exercise and they sleep very well, and that is really good health. But if you want to be at optimal health, you need to have your spine checked on a regular basis for any kind of problems based on the information we've presented today.
Yeah, so the most important thing is to understand that pinched nerves do not correlate with pain. They sometimes do, but you don't always need to have pain as a symptom to have a pinched nerve. And that's the most important, because a lot of people, they come here and chiropractic, they think back pain and neck pain. And as we show them this diagram, that the brain and the spinal cord actually controls the organ function and everything else along that the body does, that's when the light bulb goes off, and then we begin to see, wow, I've had acid reflux for about 5 to 10 years. I've had different things like constipation that I've been experiencing. And can a chiropractor help them with that? The answer is if it's due to a pinched nerve. So we can't fully say that yes or no, a pinched nerve is causing that symptom, but with our technology, we take the guessing out of the game, and what we do is we end up using the tools that we have in this office and utilize them to figure out what exactly your body needs.
So for more information about chiropractic and health and wellness, click on any of the information below the video.